Okay, we're rolling. Dr. Loh.
Hi.
Hi, thank you so much for coming.
Thank you for inviting me.
No, I mean, really appreciate you. It's a Sunday afternoon. Today happens to be a very hot afternoon.
Yes.
And I kind of feel bad that you had to wait outside the door because
It's fine. Yeah, it's
you were
okay.
here early. And I just got to know that you just finished a shift initially when you spoke with me 2 days ago, right?
Yeah.
I thought that you would be pulling one of those night shifts on Friday night.
I see. Well, this week is a little busy, but I mean, I'm working both weekends, but I think I'm glad that I still had time to come.
Okay, so you work every weekend.
Well, for this week and next week, I'm working every weekend, so it depends. Yeah.
Okay, so then you will get the off in due during the weekdays.
It depends. So sometimes certain months we have to work more weekends if the manpower is low. So for me, I'm working these 2 weekends, and I also worked 1 weekend for the month previously. So our roster monster will basically schedule for us.
Okay, so the last I understood, I think I saw on one of our videos, you were a doctor, ward doctor in IMH.
Yes.
Are you still in IMH? Still with
No.
IMH?
Now I'm actually in the National Center for Infectious Diseases, NCID. Yeah.
Okay.
So it's more of infectious diseases like COVID, pneumonia, tuberculosis, that kind of setting.
And do you all do like the 3 shifts as well for doctors? I know the nurses do like 3 shifts, right?
Ours is a little different. So we have a normal like daytime shift, which is about 8 to about 5, but usually it's a little earlier and a little later, or a lot earlier and a lot later. But if we have night calls, then we will continue to work until the following day about 12 p.m. And after that, if we can, we will go post-call. So it's that's the setting for me, but I think different hospitals have a different kind of arrangement. Yeah.
What do you mean by if we can?
Sometimes if you have patients to see still, or if you are not actually done speaking to families, then you have to stay back a little later.
Okay. So does it mean that because you mentioned about how it's a lot earlier than 8 when the start time is 8, right?
Yeah.
So if let's say you know that today your working time is 8 a.m., what time will you arrive at the hospital?
Usually we would arrive earlier, about 7 plus, and the reason we do that is to make sure that we are aware of like the vitals of the patient, like whether anyone's having a fever or hypotension, and if they have any issues, we can actually see them earlier. Yeah, so I think that's kind of like the practice for us.
Okay, what's a day like as a junior? Are you still considered a junior doctor? How long have you been practicing in?
So I have been working for about 4 years. So because I have not chosen my specialty previously, I'm currently like a medical officer, which is about the second rank. Like the lowest one will be the house officer.
Okay.
So for me, I think my day job is still basically functioning very much like a junior doctor. So I have to actually make sure that the patient's vitals are okay from the very beginning. And then after that, I will do my rounds if I'm in the ward. Yeah, and if I'm not in the ward, I will be doing clinics, or I will be taking referrals. So we are usually posted to different parts to have better exposure.
Okay, so let's say you're now in NCID.
Yes.
When you do clinics, what kind of patients do you see though?
The patients in clinic can be very different. So usually infectious diseases, they can be on follow-up with different conditions, like commonly it will be like HIV. Yeah, but there are also other conditions, like for example abscesses in the liver, for example. So we see quite a wide range, but mostly infectious diseases now that I'm here.
Okay, so all HIV patients are looked after by the NCID.
So many of them are, but there are other hospitals who also take care of HIV patients. Yeah, but I think the very complicated ones usually are followed up here.
Okay, do you see cases of like, maybe not, but for long COVID cases?
Well, we have COVID patients, and most of them are actually seen in the inpatient setting. So that will be patients who are immunocompromised, having cancer, or some other issues that lead to them being at higher risk. But for long COVID, actually the symptoms itself usually can be treated with medicines that are just for the symptomatic treatment, not the COVID therapeutics. So for now, I think those symptoms can be managed outpatient by general practitioners as well. But of course, if there are other concerns, then they get referred here. Yeah, but personally, I've not seen one myself.
Okay.
Yeah.
You mentioned about going on rounds, doing clinics and all. Is there a particular portion or aspect of your job in a day-to-day that you enjoy the most, and on the other hand least enjoy the most?
Well, I will speak about what I enjoy most first.
Sure.
Yeah, I think that I generally like to work with a team. So if I work in a team and then we speak to patients' families, there is communication going on, then there is some form of satisfaction. Yeah, you can actually see that families are appreciative and also your colleagues are helping you. So I think that helps. But on the other hand, what I don't really feel is that healthy for anyone, including doctors and nurses, is when we have to work overnight. So the night shifts are quite punishing. I think for me, I've gotten used to it because I've been working for some time. But for those people who just started out, I think it can be extremely draining. You can actually be so tired the next day that you sometimes just feel like you're not thinking clearly. Yeah, but I think now it's a little better because if you really don't feel well, you can actually report sick. Yeah, which I think is understandable. Yeah, I think unless you are someone like me or some of my colleagues who have been doing it for a long time, then we are kind of used to it.
It messes up your bio clock.
It does. So I think for me, when I go overseas and there is like some time zone difference, I kind of adapt a bit more quickly. Yeah, because I'm kind of used to having to work with a different kind of body clock. Yeah.
I'm curious though about this the scheduling of doctors and nurses, right? There's this night shift.
Yeah.
So is the idea that everybody should do their part to play in the night shift as well? Or why is it not, for other industries and all, typically the way they do it is that, there are day shifters and there are night shifters.
Yes.
So there are people who just rather, I'm just a night shifter and I do night shifts all the way. And I suppose in a way the bio clock can get a lot more used to it as well.
Yes. I actually think that actually it's a little historical as well because we have inherited the system for a long time. But there is such a thing called night float, which some hospitals tried to do. So that means, like you said, they will only work at night and in the daytime they will go home and they will rest. So it is very much like the normal day shift, night shift that other industries have. But I think maybe a concern at that time was manpower issues, like whether or not you have enough people in the daytime then. Yeah, I mean, obviously I'm not, in charge of the manpower, but that is something that I think might be a reason. Yeah, but I think some other countries like Australia, they actually do have night float more than on calls. That's what I heard from some of my friends who studied overseas. Yeah. But for people like me, I think I'm used to the system, so I don't really mind it so much. But the people who start out, I feel for them because it's hard to adapt.
So you enjoy working in the team?
I enjoy working in a team. I think that my colleagues also teach me a lot of things that, I may be more deficient in because everyone has things that they are not so good at. So for some of my colleagues, they are very good. For example, with speaking with people who are like very old, they actually communicate with them really well. So I feel like I admire them for their skills and their soft skills, and I think that that's also something that I myself am trying to learn.
I mean, it's a language thing as well, right?
Yeah, it is. Yeah.
And it's also, I don't know, there are some people who have more 老人缘 who, just naturally connect better with. And you also mentioned that you enjoy that interaction with families.
Yeah, I think that it's important to realize that in Singapore, actually, people are not so individualistic. You have to consider the concerns and the expectations of families as well. Because when you treat a patient, a lot of the times the patient will also defer to the viewpoints of their family members. So it's really more like a family unit that you have to, consider rather than just one single person. Of course, I think the patient is at the center of everything. Yeah, but a lot of the times they will want you to update their family members as well. So it's important to make sure that the rapport is there.
Yeah, so you have this spokesperson kind of system, right?
Yeah.
The first spokesperson, second spokesperson. But at the same time, I mean, there are also a lot of, if you go to the hospitals and a lot of public institutions now, there are a lot of warning signs, warning people that our staff respect you. At the same time, you should also respect our staff.
Yes.
And any abusive behavior towards, especially healthcare workers, will not be tolerated. And I'm sure in the 4 years, there must have been less than pleasant experiences.
I think that especially with COVID, actually there were some restrictions with visits to the hospitals, and not everyone is understanding towards that. Like they have a lot of concerns, worries about the patient, which is also very natural. Yeah, but actually at that time, I think the situation called for more restrictions. So actually there were a lot of times when we had to, really speak to families for a very long time just to let
Over the
them
phone.
understand. Sometimes over the phone, yeah. Sometimes they are not in the ward itself, but we can speak to them in like say a conference room outside. Yeah, so that can happen as well. Yeah, I mean, but of course, I hope that everyone can be more empathetic to the plight of healthcare workers, because we are also actually very strained, and our hours are very punishing. So if they perhaps can consider everything as a whole, and that we also work under a system, it's not like we can make all the decisions, then perhaps our conversations and interactions will be more pleasant. Yeah.
Okay, what's the longest shift?
Well, I think that we are supposed to work, like say from 8 a.m. of one day and then till 12 the next day.
Which is like 16 hours.
I think around there, yeah.
Okay. So what's the record?
I actually don't really remember because I don't really keep track of the time. I think after you work for a certain number of years, you don't really keep track of the amount of time you have worked. And even like say weekends, I also don't really keep track how much I've worked, because I just leave it to the roster monster to plan it for me, because I know that they are also stressed. Yeah, they try to allocate it as fairly to everyone as possible. Yeah, but I mean, if say a lot of people are away or on leave, then someone has to step up, and that person might be you. Yeah.
Is the roster monster a fellow doctor?
Yes, it's a colleague of mine.
Okay.
Yeah.
And he is. Do you all take turns to be roster monster?
Well, most people volunteer for it. Yeah, it's
Okay.
almost like an extra administrative job that you do.
But if you are the roster monster, you can roster yourself a more pleasant schedule, right?
I think you can roster yourself to do the weekends that you are free for.
Okay.
Yeah, so I think, but most of the time the roster monsters need to have good EQ and people skills as well, so that people don't get mad. Yeah.
I don't know if you watch football, soccer.
No, I don't.
At EPL, so before every season, right? There's the roster monster as well. That rosters, every team, like who they play, home team, away team. And there are some managers who always complain that the roster monster is being unfair towards their team.
I see.
So you might be, for a period of time, you might have a very punishing schedule like you talk about,
Yep.
So what's the part that you don't enjoy? The aspect that you least enjoy about your job, day to day?
Actually, yeah, I think the one that I least like is still the night calls. That I mentioned just now. Yeah, I mean, even though I'm used to it a little more now, I still feel like it's quite taxing on the body. I can feel like the strain, like say the next day. Yeah, because we are expected to work the next day, even if you go post call at 12 p.m. the day before. So I can feel like my body is slowing down.
So that means you end your shift at 12, you go back and rest, and you have to be in the hospital again at 7 plus a.m.
Yes, yeah.
Okay. The full all-nighter one is slightly better because you get to rest the afternoon the next day.
Yeah, I mean, personally, I've not actually been on night float, but from what my friends, I've not been on it. Yeah, I think it's a matter of like luck, whether or not you get to go to a department in a hospital that practiced that at that time. Okay. I did not manage to, but my friends who underwent it tell me that it's a little better. Yeah, so, well, if one day I actually get to experience it, I think that'll be great. But if I don't, I think in the current circumstance, I think everyone has to understand that they just have to be willing to take more workload.
Do you see the great resignation with your eyes in the hospital?
Actually, I think that there are other healthcare workers who have been thinking about leaving the public sector. Not necessarily doctors, but also nurses and even porters. I mean, everyone in the hospital is very overworked, so I wouldn't be surprised. Yeah, I think those who stay probably have their own reasons as well. Like they want to maybe complete training, or they feel like the public sector is more suitable for them. Because when you go to the private sector, there are a lot more considerations, like you have to take care of the administrative part of the healthcare system. And, I think it is not really everyone's cup of tea.
You mean when people go out and start their own practice?
Yeah.
But you can't really do that until you are at a certain level of experience and
yes.
seniority in terms of your network and...
Well, I mean, you can do that as a general practitioner, I suppose, or you can complete training first.
Oh, you mean as in be a GP?
Yeah, like a GP.
Okay.
Yeah, some people like want to do that. Yeah, they can take like a graduate course and do that. And some people who want, they will stay until they get a specialist kind of a position, and then they thereafter plan to go private. I mean, that happens as well.
Oh, so what's your plan? Do you have a plan?
For me, I think I am interested in preventive medicine, so I do hope to do training first. Yeah, and I also have interest in academia, like, writing, research, conducting research. So I think that's probably what I plan to do.
Is preventive medicine working with the elderlies and it's more of the seniors?
Preventive medicine can be actually about anything that has high healthcare burdens. So both communicable, non-communicable disease. And in Singapore, those that are of very high prevalence are things like, diabetes. We have declared war against diabetes. And we have an aging population. So all the geriatric conditions like stroke, as well as, high cholesterol and hypertension, all that is part of preventive medicine. So, instead of trying to treat these conditions after someone has them, the idea is more of to prevent them in the first place. Yeah, and another one that is communicable disease, like more of infectious disease, will be things like the COVID pandemic. Yeah.
Okay.
Instead of trying to treat people after they get it and become very severe, you try to implement things like vaccines and programs to make sure that people, as far as possible, not catch it in the first place, or if they catch it, then it's much less serious.
Okay. It's very interesting for me to talk to you today because the last 6 years, right, my mom hasn't been well, and she has spent a long period of time in the hospitals at certain period of her journey, not being well. And I've always been kind of like the main caregiver for her.
Yes.
So there was a period of time whereby I still remember the longest stretch was like 2 months plus, 70 over days. So I'll be at the hospital every day. And the interesting thing about being in the hospital is that when you're sitting down in a ward, a lot of time when it comes to like patient-family relationship, it's more of just being present there for them, so they don't feel so lonely and they don't feel... I don't know if it's too tough a word to use, but sometimes I feel abandoned at hospital as well.
Okay.
Because you're just so alone, right? And the thing about going to the ward and visiting a family is that time seems to go on a slower pace. Okay. So you feel like you go over there and you feel like you have sat down for quite a while. And you look up at the clock, it's like, oh no, it's only 15 minutes,
Yeah.
And then later you feel like you have been there for a long time, and the fact is you have only been there for half an hour. And you see a lot of like just live episodes happening around you. People, other patients, other families. I've seen families in the ward, like all kinds of stories. I just want to share with you one of my most memorable one. Like there was this quite old lady. A lot of elderlies, right? For them, at a certain stage of their life, and I think it's going to get more prevalent because of the aging population, like you mentioned, right? A lot of them at a certain stage of their health condition, right? They feel like it's better for them to just die rather than just like suffer there, And it's true, sometimes when they are at a certain stage, right, you are just waiting for your next meal. And and even things that we take for granted, like going to the toilet, like passing urine and passing motion, becomes a hassle as well. Some of them, they have catheters that go inside, they have all kinds of lines, right? So there was this old lady. I actually can't speak Malay, and I have very poor understanding. I don't understand Malay. But it just so happened, and a lot of elderlies, right, they like to speak Malay in the hospital.
Yes. Yeah.
From the kampong days, they can, like the kampong, they have Malay neighbors, and they have a basic command of Malay, right? And they, and of course we have healthcare workers who are Malays as well, and sometimes they, maybe they look at some other nationalities and they think that maybe they look Malay as well. So she was very aggressive, and unfortunately she was restrained, because she was being a bit abusive towards. And she said, saya mati lagi bagus.
Okay.
So, I mean, I don't understand Malay, but just so happened that all these words I understand, right? Like saya, me, mati, die, lagi, better, bagus, lagi bagus. And there was this staff nurse or this nurse who was quite heavily pregnant.
Okay.
Who went to attend to her, and she pounded on her tummy.
Okay.
Like she just punched her tummy.
Okay.
And the nurses got shocked because she's heavily pregnant.
Yeah.
And although Amma is not well, but she's still quite, she has
Strength.
good strength. And understandably, the nurses were very upset, and they just told her that, how can you do this, And you just see this whole process of life, right? Like 生老病死, in the hospital. Like sometimes you go down for lunch in the lobby and you see parents bring their children, for an appointment or something. And in the ward, you see this aging process, and you see people who are very ill. Then you see people who, who pass away as well.
Yeah.
I mean, I've seen in the ward as well,
Yes.
families just crying, and the patient is just low. You can see the SpO2, the saturation is dropping, and everybody is just waiting for the inevitable, and it's just this whole what you learn in life about life, in the hospital. For me, the last 6 years was just even my own experience with my mom, my own grandfather. Has there ever been for you a more memorable experience? If you can share without, with all privacy, respect to the families,
I think I actually wrote about it before, but for me, I think that palliative medicine or palliative patients are one of the most memorable experiences. I think there is something about death that is very different from every other specialty, because a lot of people have spoken about death, and when someone can actually prepare for death, you really see what their priorities are. You start to understand more about what life is about before you die, and I think people start to actually understand what they value more. So I think one of my experiences was actually about a patient who gradually passed away from cancer. But while he was actually still alive, I think he was actually trying to ensure that he has basically made sure that all his family members' emotions are cared for. So he actually put his family members before himself. And I could just see that this person really understood that the life is yours and you are going to die, but the world is not revolving around you. There was a lot more worry for his children at that time, because I think it was a very closely knit family. So the children were understandably found it very difficult to let go. The patient was ready to let go, but the family members found it difficult. Because I think there were a lot of things that they still wanted to do. But I think the patient kind of had a hunch that his time is drawing near. And the things that he did in his free time, they were very simple things. I think that a lot of people might think that before you die, you have to do something very drastic. Like you have to go to another place, see another world.
But actually, world tour or something.
But actually, I think that there is a lot of comfort and peace in doing what is here right now. And sometimes that can actually bring you more peace and joy than what you had imagined. So I think it's about living in the moment, and while you have it, really optimizing what you have, cherishing relationships more. Because I think, if you were not going to die, you might not cherish relationships as much. You would think more about, is my career going well? How much money am I making? But at the end of the day, I learned that, through these people's lives, like the kinds of memories that you forge, with who, and the relationships that you have forged actually mean so much more. So that's one thing that I have learned that I'm very grateful for, because I'm still pretty young. I haven't really thought about death very much. It's only through these people that I see that I learned all these, moments of wisdom. So for that, I'm very grateful.
For yourself personally, have you been in palliative medicine?
So as part of our medical postings, we have to do palliative medicine. Some of us do get posted there, and I have been there. And in fact, I'm going to take a graduate course on palliative medicine just for knowledge in case I ever need to prescribe, analgesia like morphine or some other analgesia to palliative patients who are in hospice or home hospice. So I feel like, that kind of knowledge may help me let them have a better death in that sense, so that at least towards their last moments they feel comfortable and they're not in pain, which, is the priority when death is imminent.
Have you had experience with death as a child growing up, like family members, elderlies and seniors in the families?
I actually had one when I was a little younger, but I was not a child. I was probably in university already. But my grandfather actually passed away from cancer. So I feel like it really becomes a matter of, the time that you want to maximize and also how that person wants to best, basically live until he passes away. And I believe that at that time, my grandfather was already very old, like 80 plus, and he was actually more or less like happy doing what he was doing. But I think at that time, it was the family that actually found the diagnosis quite shocking.
Okay.
Yeah, but I think my grandfather himself was still quite happy, and he found a lot of comfort in, for example, in religion and his faith. And I think that's an aspect that people shouldn't forget as well. Like there are a lot of aspects of medicine that is not just the science, but like the art as well as the emotional relief and comfort that you feel when you're actually going through a very difficult time. So that's something that I kind of saw with my own eyes.
Has there been a fundamental change in your life, the way you lead your life after being a doctor?
I think that, to be very honest, I feel I am very much a science person. So I enjoy looking at statistics, at data, like the hard knowledge and stuff like that. And I think as a child, that's just something that I find important. And that's the reason I feel like, having this knowledge and you apply it, you can help others. That's great. But I think as I start to work, I kind of feel like, this kind of environment is not just about what you know or how much you know. It's also about, how you actually make a person feel like that person is well taken care of, and the art or the humanistic aspect of it became more clear. I mean, it became like more important to me, as I started to work more. I mean, I still enjoy statistics and data, but I feel like understanding that person's, predicament, because every patient's different. It's not like the same condition and everybody is like the same cookie cutter. Everybody has different expectations. Some people want to really go very far and be very aggressive. Some people just want to make sure that they actually, if they're very old, make sure that they have like the rest of their lives in relative peace and comfort. So I think then I begin to feel like you have to understand the person more than the condition.
So the empathy is very important. Being able to like understand what they want. Because at the end of the day, nobody is going to live forever.
Yes.
And a doctor can't save everyone as well.
Yes. And I think that living a very, very long life, prolonging it indefinitely is also not what everybody wants. I mean, if you are already bed-bound,
the quality of life,
is not there. Some people may not actually want to prolong it like indefinitely and be very aggressive.
One of the doctors that I love listening to speak the most, I mean, he's now a politician.
Okay.
He's actually the mayor of Taipei.
Okay.
Kebun.
Okay.
So I don't know if you have read a bit of his stories, but one of the interesting things that he talked about was that when he was a doctor, when he was a practicing doctor, he was for a long period of time, he was in ICU. So he was, looking after the patients and literally like you see people come and go, patients come and go every day. Right? Then eventually his boss got him to set up this department whereby his ward, right, would take in patients that no other faculties would take in.
Okay.
Like not outpatient, not inpatient, not oncologists, but some patients who are just, they have so many like overlapping kind of conditions, right? Whereby you don't even know which department that they fit in. Yeah, and they are just like in their terminal stages. So that ward will take them in. And he has spoken about how, as a doctor, right, you are like a gardener, So you can't control the seasons, but the only thing you can do is to help the flowers and the trees like bloom a bit better, depending on the season.
Right.
Yeah. So he is someone that, in fact, my mom was the one who introduced me to, because he had a TED talk that my mom really enjoyed watching. So she was the one who like sent me the TED talk. Then and that TED talk I still revisit it from time to time. So for you, you are still, like you said, still quite new in public service as a second level junior doctor.
Yeah.
And I always like to think about the podcast, right, as who are the potential audience who might be interested in this particular episode. And for just students, right, who are taking their A-levels, taking their exams, and they are thinking of doing medicine. Well, I suppose for doctors, a lot of them is either they aspire to become a doctor, or I don't know, I get this impression for a lot of doctors is the families aspire them to be doctors. and therefore they are nudged along this path to become a doctor. Yeah, maybe you can share your experience as well and your advice for all these aspiring doctors.
I think that the first thing to realize is that I think in Asian communities, yes, I think being a doctor is something that a lot of people or their families aspire to. And the problem is actually that people don't understand the amount of sacrifice that you have to put in, whether you are a student or you're like a working doctor. The amount of time and effort that you put in is a lot. Yeah, so I think it's probably something to consider, because when you're young, you probably don't think of it very much. But as you get older, you have other aspirations and commitments. Yeah, then the question is, is this kind of a lifestyle suitable still? And another thing that they also may want to try is to look at healthcare professionals as a whole, not just doctors, but whether or not there are other kinds of roles that they might like a bit better. Yeah, so I mean that can include, for example, social work, and nursing. Some people also consider that, because I mean, the levels of difficulty is still there, but I think some of them don't, at least some of them don't work overnight. Like I think social workers, they don't work overnight. So I think in terms of the time that they spend in the hospital itself is not as much. Yeah, so that's something to probably consider if they have the interest. Yeah, and another thing is probably also to look at things that are not in the hospital but related to healthcare. So that will include things like health policy or research if they have interest in the science, or the for example, manpower or like healthcare system aspect of medicine that is not just about patients but nonetheless still very important. Yeah, so I think healthcare is a very big sector. You don't necessarily have to look into just one aspect of it. All aspects I think are important. Just make sure that you have the readiness to take on challenges and be adaptable, if you really want to pursue this.
What's your experience like? Have you always wanted to be a doctor?
Actually, I only decided maybe towards like the end of junior college, I think.
Okay.
Yeah, I think I was someone who was actually quite open to options. And I also did a lot of internships or attachments at that time to sort of figure out what I really like. Yeah, because I know that I want to make sure that I want to choose something that I wouldn't regret being inside. And I think I did at least one wet lab attachment, like with A-star. Yeah, so I understood what, bench work was like. And then I also did a few other attachments. And I think the one that I did at the National Cancer Centre was particularly meaningful. Yeah.
Oh, you can do an attachment.
Yeah, at that time I could. Okay. Yeah, now because of COVID, I'm not sure if you can. Yeah,
okay.
But
what was the attachment about?
So it was actually about oncology and cancer patients, and I think the bulk of it is breast cancer, the one that I was exposed to.
Mm-hmm.
Yeah, so I mean, for cancer patients, there's really a host of treatments. It's not just, chemotherapy, which most people associate it with, but there's also the surgical oncology aspect, which is about surgery, taking the tumor out, and also radiation oncology, like giving radiotherapy so that the cancer shrinks. Yeah, and of course the palliative medicine part, if it's like a stage 4 cancer, then you have to think about the analgesia and the symptom control, whether it's pain, breathlessness, and things like that. So I thought that it was actually very holistic, and I feel like there's a lot of meaning in the things they do. So personally, I feel like that attachment was very impactful, and one of the reasons I chose medicine. Yeah.
Okay. A lot of people have very little understanding of chemotherapy as well. Like for me, right, my own experience, like everybody knows about this term called chemotherapy, but I didn't know that there's actually like oral chemo tablets that can be taken just orally. My idea of chemotherapy was always like IV.
Okay.
You sit there and they give you an IV and you feel like your whole body is like I didn't know there's actually oral chemo tablets as well. So yeah, so have there been any pressure from your family to become a doctor?
Thankfully, I did not,
Okay.
because I think my mother, who is basically the closest to me in my family, didn't really pressure me to choose something in particular. In fact, I think she was a bit worried about whether or not I can cope with the hours and the rigor of the studying as well as the work, which is well-intentioned. And I don't think that she actually wanted me to do something in particular. I think she was actually happy with me doing whatever I chose. So at least for me, I didn't choose because my family wanted me to.
Okay. So that's your whole experience growing up as well, whereby you had parents who supported most of your decisions?
Actually, for me, I was growing up in a single-parent family because my parents had a divorce when I was really young. So I actually don't know my father's side of the people, but my mother and my grandmother were the people whom I grew up with. Yeah, so I think both of them were very strong women, but they didn't say that, you must, go into this direction for your life. If not, you're considered a failure. I don't think there was a time when they actually said that. Yeah, and thankfully my childhood was a very happy one. I mean, I grew up in a neighborhood primary school, and it was one of my happiest memories. Yeah, and I feel like people have to understand that, your family is very important. But the choice that you make, like the consequences, ultimately you are the one who has to bear it.
You have to take responsibility yourself.
Correct,
right?
yeah, you have to take responsibility for your life.
Do you have siblings?
No, I don't.
Okay.
Yeah.
So it's really a very close-knitted kind of family. You studied in Anderson Primary, right?
Yes, I studied in Anderson Primary.
Yeah, I did my homework.
I am very impressed.
No, I read some of your columns as well.
Yes,
and also, so I saw that you studied in Anderson Primary, St. Nicholas.
Yes, that's my secondary school. Yeah.
And I also inferred that you stay nearby here, just in Yio Chu Kang, Ang Mo Kio.
Yes, around that area.
Because I read this article that you wrote about meeting, what's that guy's name? Charles Loh.
Yes.
Yeah. And you mentioned that, your MP is Henry.
Yes.
And because my grandfather's MP is Henry.
Ah, okay.
My grandfather stays at Ang Mo Kio Avenue 4.
Okay.
So I grew up in that area as well. So I know that if you stay in the area and you went to Anderson Primary and you went to St. Nicholas, actually you grew up in that
vicinity.
Yeah,
yes.
that vicinity as well. So it's really more of a neighborhood.
Yes.
Like in the sense, you grew up close in the neighborhood. Yeah. What's your favorite food at this Yio Chu Kang area, the place that you stay?
For me, I always go to the Mayflower Market because it's very near my secondary school. It's just across the road, and it's also quite near where I live. Yeah, and the hawker centers there have a wide variety. You can choose whatever you like.
I grew up like with the neighborhood there.
Okay.
So to share just a side story, family story.
Yeah.
The area you talk about, one of the favorite Senics hangout. During my generation.
Okay.
I think we are from a slightly different generation. Maybe I suspect we are maybe about 12 years, 10 years apart. Is that McDonald's.
Yes.
at, along Avenue 4.
Mm-mm.
And during when I was in secondary school, right, we had no such thing as iPod or MP3, start to have already, but it's still mostly CDs.
Wow, okay.
Yeah, I don't know if you have ever seen one of those machines, like a junket machine, whereby you can flip through the albums and you can like buy 3 songs with $1, and you can choose like 3 songs to play. And they had one of these machines at the McDonald's. And the Senix girls used to love to, after school, they would just hang out there. And it was that period of time whereby Zhang Xingzhe was the, the 情歌王子.
Okay.
And, Senix girls love Zhang Xingzhe. And why I know that McDonald's well is because my grandmother used to work at that McDonald's.
Okay.
So my grandmother has been a homemaker all her life. And in her old age, right, she decided that just for her own, sort of like pocket money and spending money as well, she wanted to go and have a job. And she also found a different world working in McDonald's in her old age. Because it was the first time in her life, right, whereby she had this work culture environment that she was in.
Yeah.
So she had a boss, she had a roster monster who would, who would roster her. And she had colleagues, she made friends. And once in a while, the workplace, they would organize like a trip out somewhere. And she really enjoyed herself, working in McDonald's at an old age. Although we encourage her to, stop doing it, retire, because the McDonald's is kind of like on a little slope, right?
Yep.
Avenue 4 is like sloping up, so you like walk up a slope. So we stayed at the block, like at the foot of the slope. So she would have to walk up the slope. And McDonald's provides staff meal, right?
Yes.
So she would sometimes she would. Because when you eat McDonald's every day, like why the hell would you eat McDonald's every day? You also get sick of it, right? So she would put the McWings in her tissue paper, then she would put it in her bag, then she would come back, then I would eat the McDonald's. So I have very fond memories of that place, and that's why I kind of like know that place very well.
Yeah.
And the Mayflower Market, the evening, the satay store, the rojak, these are all things that I grew up with. So when I read that, you grew up in that area, I was like, it's a place that I know and I grew up very well. Coming to the article that you wrote, meeting Charles Loh.
Yeah.
And also you mentioned about, doing some volunteer work in the community at the Meet the Paper session. Earlier, before we started this interview, you mentioned that now because of time constraint, you are not able to do it as much as you want to. What do you think is this aspect of community service that make you want to do it as well?
Right. I think that community service basically allows you to actually get in touch with what people are interested in and what they want. I think a lot of the times we are in this echo chamber where we, hear things from people around us only, or even from ourselves. But that may not be reflective of what most people want, or what are really the problems that the community is facing. I'm someone with a lot of curiosity. Before I, wrote for Today, I was actually a correspondent for Lianhe Zaobao, a student correspondent. Yeah. A lot of people don't know that, but I actually wrote in Mandarin like over 50 articles as in when I was a student, and nobody knew that. But what it did for me was basically having this curiosity to know what is, the trend, or what are people, concerned about, what is the next big thing. I was just very interested to know what other people thought, what they were doing. So community service actually gave me a way to know other people whom I usually don't meet. Yeah, I think that one of the things that I actually saw during community service that allowed me to basically like view the work differently was that I come into contact with people from different ages who do different kinds of jobs or have no jobs. Yeah, I see people who have struggles that I myself have never undergone, or imagined. So I think that makes my life a bit more interesting and give me more wisdom and perspective. Yeah, because it's very hard to imagine what other people's lives are like unless you have met them. And some of them really come from like backgrounds that are very, very different. And I think for men, they get to see that when they're in national service. But for me, because I don't serve the nation as a woman, so I don't have that experience. So I think community service is a way for me to get in touch with these people, and understand what are some of the lifestyles, like if, they are not the kind that I have known. Yeah. So I think that's one thing that's important to me. And the second part of it is probably actually being able to understand what's current affairs. Because I actually like the media a lot. I read and write for the media. I also understand, that there's a lot of news going on globally. But there is really nothing different if I read the same book or read the same news as everyone else. Actually knowing specific people, listening to their own unique narratives, give me a chance to see what it actually is like on the ground. And I think, I don't want to sort of be too brainwashed by just what I read, what I watch. Yeah, but I want to also like understand what common people have interest in. And I think, because I usually interact with people who are very young, that gives me a very myopic view of the world, because the young people are probably looking at topics that the old people are not looking at. Like my friends may be interested in TikTok, or some other fashion trends, but the old people have a very different perspective. Some of it get covered in the news, but not everything. So I feel like it allows me to have like a broader perspective, that's more genuine, and I can put a face, a name to that particular issue.
I would have thought that, as a doctor, you would already be, coming across people from a wide, diverse background. And
I think luckily my work actually did give me a bit more exposure to people from different backgrounds.
So do you feel that it's still quite narrow?
I actually did community service before I was a working.
So you started way before.
Yeah, so I started way before. So it then became like something more like a way of life or something that I have done before. So I continue with it. Yeah, but I do think that it is important for everyone to have a very broad, have broader perspectives about the issues in the world and not be too, self-absorbed. Because I feel like in my generation, a lot of people are just concerned about what they have interest in, not what other people are interested in.
I hesitate to ask you for your age.
Okay.
I don't think it's public knowledge. I think I was trying to look for it, like how old are you? For me, knowing my guest's age, right, it's just something like for context.
Yeah.
Like I kind of understand like where you're coming from when you talk about your generation. Would you mind telling the audience your age?
I don't mind. It's actually in my articles if you read some of them.
Yeah.
I am 28.
Okay.
Yeah, so I kind of belong to the Generation Y or Millennials. But of course, some of my friends are a bit older, some are a bit younger.
So what do you think your generation, your classmates, if you still keep in touch with them and all, like what are they concerned about?
I think the young people have a lot of worries about the economy. Now there is a lot of talk about lack of jobs or people having to take up jobs that they don't really like or it's not what they want to develop themselves in. So even one of my classmates is struggling with that. So I sometimes speak with her to kind of see how things are going.
So she can't get a job that she likes?
In that sense, it's not related to what she studied. It's actually quite common for people to have to take up another kind of job now, post-pandemic, the kind of markets and the kind of so-called jobs or vacancies available is very different from pre-pandemic. So I think that's something that everyone's trying to adapt to.
So they can't get their ideal job?
In that sense, yes. Yeah.
Okay. So not even ideal company, just ideal job scope.
Yeah, it's actually harder than, what I imagined. Yeah, some of the people that I speak to, they really just do the job mainly to just make sure that they actually are engaged with
and
society.
survive.
And survive. Yeah.
Pay the bills and
keep
up with.
Yeah, it is not to say like, you can't do that. But I think a lot of them have bigger aspirations. So I think that's the tricky part. Obviously, if you have to do a particular position that you didn't, want at first, but you're still learning from it. I think there's actually no harm trying to maximize your experience. Yeah, but I think the pain comes when you actually want to do something else that you want to do. Yeah, but you can't do that yet. Yeah, that's the trouble. Yeah.
I'm curious though, like for this friend, what industry is she in that she would like to get into but she can't?
She was so she is doing F&B now. So basically doing things related to food and deliveries. Yeah, but I think what she really wants is probably look at something more administrative. Yeah, or like maybe HR or PR related. Yeah.
Oh. She can't get a job in HR, PR?
I think she hasn't had a lot of experience yet, so I think that's one of the issues. Another one is, of course, I think she is also somewhat, worried about whether she's cut out for that job. I think it's also, something perhaps like lingering inside. Yeah, that whenever the opportunity comes, whether or not she is ready to make the shift. Yeah.
So still be confused and exploring and searching for what she wants to.
Yeah.
Okay. What's on your mind right now? What are the things that you're concerned about?
Well, I recently came back from a conference in Bangkok. So the conference was a lot about like global health, planetary health, and climate change. And I think that's the main thing that I've been thinking about because the conference was just weeks ago. Yeah, and it's somewhat related to preventive medicine because preventive medicine is mainly about public and occupational health. Yeah, so that's what's on my mind right now. Yep.
Okay. What about day to day?
Day to day, well, I actually think about developing myself not just in medicine, to be very honest. I don't really believe that a person should just focus on his or her career because, I think in Singapore we have a very fast-paced life and your work is generally what you are told to do and you spend a lot of time on it. But as I become, a bit older and I kind of like look at my journey, I kind of think that, life is really not just about work. There is so much more, and I kind of regret a bit that I didn't travel as much when I was younger. Yeah,
because as life gets to a fast pace, you didn't really get a chance, right? Okay.
Yeah, and I think I didn't cherish the opportunity that you could travel, until the pandemic hit and you realize, you can't travel.
Yeah, actually, we took it for granted, a lot of us.
Yeah. So that's one thing that I wish I did when I was a little younger.
So what's your aspiration like for the future? Where do you see yourself?
I actually see myself doing something that is a bit more public health related. I have come to the idea that that's something that I am actually relatively good at and I understand to some extent. Of course, I haven't taken a master's in it yet, which a lot of other people who do that residency they have to do.
So like public policy.
So it's about public health. So it encompasses policy work, but it also encompasses other things. You can still see patients as part of occupational medicine. But you also do more research, which is something that I also quite enjoy. And that's something that I think would be a good fit for myself. Yeah.
Having had some exposure with people like Charles Loh, Henry Quek, do you have a personal interest in politics?
I think in Singapore, politics is not as simple as it looks because it's not just about drawing policies. There's a lot of aspects about having to be engaged with the people around you. And I think that for me personally, it's not something that I want to develop yet, but I have interest in policy as a whole. Yeah, and I think I also have interest in diplomacy actually. So that's one reason I actually joined this organization called Business China Youth Chapter, and traveled to some parts of China. Yeah, I think it's just interesting to work with others, and there's this term called collaborative advantage, right?
Yep.
And for very important and global issues like the pandemic and a lot of other issues, including the economy and jobs, I think it is wise for us to have good ties with everyone in Southeast Asia, China, and other countries in the world.
I was in business China as well.
Oh, really?
For many years.
I see. Okay.
I mean, I was a member of Business China for sure. That time it was Miss Loh was the CEO.
Yes.
But I never found a lot of activities to join Business China. I don't know why.
I think maybe you weren't in the youth chapter. That's why.
Oh, okay. I think I was in the business, the corporate one.
Yes.
Yeah, I was in the more corporate one because I was involved in another company and they put me as a member and as Business China. Are you still involved with Business China?
I am involved in the youth chapter activities, which I usually am part of. I was the exco for 2 years, so I helped to organize some events and activities, and I was very fortunate to have gone to different parts of China. I think I really enjoyed the trips, and they allowed me to basically speak with like-minded people, and they have their eye on Southeast Asia and China. They have so much experience and knowledge about the region that I just feel like I have so much to learn.
You mean your counterparts in China?
Yes,
the youths in Chinese, the Chinese youths?
There are Chinese youths that I'm learning from, but there are also those in Singapore.
Oh.
Yeah, because I think some of them work, for example, in the business aspect or investment aspect. Yeah, so from my understanding, Southeast Asia is basically a rising economy, and it's important to know your neighbors well. I mean, that's something that I myself am also trying to learn slowly. Yeah. The youth chapter activities is about China, but it's also about cultural activities, what it means to be a Singaporean Chinese, because that is different from a China's Chinese.
Very different.
Yeah, and knowing your own history and your heritage well, I think will build your own cultural confidence. Yeah, that I see in my other peers in the group, which I also hope to emulate.
So anyone can join Business China, a youth?
Well, from what I know, there is basically an application process. So you just apply, and then they will give you further instructions on what to do. Yeah.
Okay. How do you personally got to join Business China?
Well, I was actually a student correspondent for Lianhe Zaobao, like I told you before. And I think at that time, they wanted to invite my interviewee, who was China-based. He's actually from this brain show. I don't know if you've heard of it. It's called 最强大脑.
Yeah, I love that show.
It's great.
I love it. Yeah.
And he is called Wang Yuheng. So he was basically someone who could basically identify objects by looking at one glance, and then you put it in the middle of similar
is it the guy who can look at water and
yes.
Oh my god, that guy is...
him.
But he how in. So you know him personally?
So I actually just reached out to him on WeChat, and he granted me an interview. Yeah, I mean, it was just over WeChat, but it was amazing because I remember that he had such great talent, and he really was a very fascinating character on the show.
He is. And he has this colourful personality as well, a bit cocky,
Yeah, and he was actually a team leader for the next season. Yeah, and I thought, wow, I mean, what he's doing is really amazing. And I thought, why not just interview him? Yeah, and that was when Business China reached out to my editor.
Okay.
And I got in touch with Business China, who asked if I would be interested to join their youth chapter. Yeah, that's how I got started.
Okay. So you found his WeChat, you added him, then he added you back.
Yes.
Because WeChat must be two ways. You can't.
Yes. I don't
they
know how lucky I was to get him as an interview.
I mean, there must be a lot of people in China who must be adding him, interested to.
Yes. So I was kind of lucky.
Okay.
Yeah, I think he was probably interested to know, what it was like in Singapore as well, because I did tell him that I was a Singaporean. So
yeah, because you can have that kind of introduction on WeChat that you can, that one-liner pitch that you can pitch to the audience, right?
Yep.
There's no later season, right? 最强大脑 They stop it after a few seasons.
I think so. I think it's hard to get, so many talents. You can imagine. That's why they had to recycle some of them for the next season.
Do you watch some other China variety shows as well?
I watch a lot of them.
Okay, which is your favorite now?
I like to watch 奇葩说, which is
I love 奇葩说. I was just going to talk to you about 奇葩说. I'm so upset that they haven't come out with season 8 yet.
I have a lot of people that also like that show around me. Yeah, and I just feel that, the levels of knowledge and the kind of skills that they have is amazing.
Oh, it's amazing.
Yeah, humor and, not just about debate itself, but, crafting in humor, current affairs, and just making it engaging. Yeah,
and presentation skills and all.
Yeah.
Who is your favorite participant, contestant from 奇葩说?
Oh, I have so many that I like, but I quite like Zhang Qingyun. She's a debater, and she studied law in Harvard, and I think that the amount of knowledge that she has is amazing.
You kind of have that same profile as her as well. Like Wen-je,
I'm definitely...
and Yeah,
definitely
she's really
not
good. She's
as
really good.
talented
Yeah.
in terms of like, because I mean she's from law, so she knows these skills, and I just can't stop listening to her. I think
She was the
she's so
BB King for
engaging.
season 6, right?
I think she was BB King for season 6.
The second last season. Okay. The others? Who else do you like?
I actually like quite a lot of them. I also like the mentors. Yeah, like Li Dan. I think he's so funny.
Oh, I love Li Dan also. Yeah, he's so funny.
Yeah, I can't. It's hard, humor is a very hard skill, and
Yeah.
like people like me, I don't think I will ever be able
I
to.
wish I can have an episode with Li Dan, drinking, over some Chinese wine, or something. Yeah.
Yeah, and he has such like an interesting personality. Yes. I think that that show kind of showed that, to be good at something, it's not just like one type of talent. Like it's not just about being very clear. It's also about being able to present something in a very short time. Yeah, because they only have a certain amount of time, and like how to inject humor into all these conversations.
It showcases the situation in China as well.
Sorry?
I think it showcases the situation in China as well.
I think,
the
yes.
amount of talent and the way people think about issues.
Yes, yeah.
My personal favorite, one of my like you, I have many personal favorites, but one of my personal favorites is Fu Shou. Because I think
funny.
Yeah, she's so funny, and also the things that she talk about always comes from her life experiences.
Yep.
And being able to quote all these life experiences and that journey of from being a nobody, right? From like being broken family, also a single mother, then a mother remarried, and of course her point of view towards marriage,
right?
And her husband, and her child is very interesting as well.
Yes.
And for me, my favorite mentor, I think, is still Cai Kang-yong.
Cai Kang-yong, actually he's very talented.
Yeah, I mean,
really.
he actually, because he was hosting 康熙来了 for regularly for like 12 years, right? 12, 13 years. And he actually they stopped that show. And I think he became a lot more active in China.
Right.
But that kind of a platform at 奇葩说 really allowed him to showcase like his like such deep content, that can come out from him, and to have I think in a lot of things, right? Let's say you're a musician or you're a boxer, you're a martial artist, right? You are looking for someone to spar with.
Right.
And to have a sparring partner that is up to par, is sometimes
it's not as easy.
Yeah. And people say 棋逢对手, right?
Yeah.
And you want to find someone who can spar with you. And I think in that show, Cai Kang-yong were able to find very, very smart brains.
Yes.
To spar with him in the earlier seasons, like his crossfires with what's that guy's name? The fat one, Voice of the Fan.
I know he's the one from Tsinghua, is it?
Yeah, what's his name?
Let me think. He's a musician, right? If I'm not
He
wrong.
plays music as well, and
Well,
long
I just
hair.
Can't remember his
Yeah,
name.
suddenly can't remember. But it's very interesting, and also one of the things that I wanted to do with this podcast, right?
Yeah.
Is that so maybe I share with you. I wanted to do 100 episodes this year.
Okay.
And I wanted to have like 20% of the episodes done in Mandarin.
Right. All right.
Yeah, because I just think that it's an online platform. I don't have the stress of that executive down, breathing down my neck on my editorial content, editorial style. And I think Chinese content has a place for many reasons. One of it is just promoting the continued use of Mandarin, right, in our daily lives. And number two, of course, there's clearly a market for Mandarin content as well. In Malaysia, in Taiwan, in China. Although China uses very different platforms, and therefore, in order to reach the Chinese audience, you would have to essentially go on like a whole new set of platforms, right? So I want to do 20% of the content in Mandarin. But now I've decided that I would spin off a Mandarin show.
Okay.
And I will have another dedicated like Mandarin show.
Okay.
And we will be, so recently I got an investor on board. And we're also looking at just distributing the content in China. And so I'm working with actually my neighbor, right? She just came back from Hong Kong.
Right.
Because her parents are aging as well. So she's decided to relocate back to spend more time with her family. She runs a marketing agency in China, in Hong Kong. So I got a lot of advice from her on how to do content distribution in China, you know. So that means you need to be on platforms like Sikuo Siping. You need to be on content like Himalaya. I don't know if you heard of Himalaya. So yeah, this is something that I want to do.
Right.
You want to distribute the content in China. Doesn't matter if anybody listens to it at all. I think eventually maybe you will find its own audience and the audience will find the content. And I wanted to, that's why I wanted to do a Mandarin interview with you.
Okay.
Or maybe you can do it in future, you know, for the other show.
Of course, yeah.
Yeah. And one of the things I was interested to talk to you about was just how do you become so bilingual?
Well, I think that it has to go back to my childhood, because I think language and understanding of a culture, you have to start young as you can.
Your mom is Singaporean?
She's Singaporean, yeah. I'm a third gen Singaporean, so as Singaporean as you can get. But I think unlike some of my peers who may feel very ashamed of the Chinese language or, you know, being too in touch with the culture.
Why? I don't understand why.
Yeah, I also don't understand why.
You know, my younger cousins, like they refuse to speak Mandarin with me.
Yeah, I think that, you know,
I don't want. You know, I don't understand. To them, it's not cool or something.
Yeah, I think it's actually more common than I thought, especially when I started to see people who come from the more English-speaking schools. I feel like, you know, there is this deep-seated shame when they hear or speak Mandarin, which is just odd because they themselves are obviously ethnic Chinese, right?
Shame is quite a heavy word to use, but I think it's a very appropriate term to, you know, to describe some of their sentiments as well.
I think that it is probably a bit stronger when they were young, like when they were younger. In fact, they might feel like it's cool not to speak in Mandarin.
To be not able to speak Mandarin. They think
feel
that
like it's cool. Yeah.
And they feel like to speak very chakantang kind of Mandarin is cool as well.
I think some people might have this viewpoint. But I think now, at least currently because of China's economic power and all that, I think more people have interest in the language. Yeah, not just the Chinese, but people all over the world. So it's a very different time now. But I think in the past, I think some people actually feel that way. Yeah, because they don't feel like comfortable to talk about their own heritage and the language. It's as simple as, you know, like not wanting to use chopsticks or not knowing how to use it. You know, that actually is a very small...
I feel like everybody still use it. Like now my friends, I don't know any of my friends who don't want to use a chopstick because of...
Yeah, I think that it is more like they can't use it very well. Yeah, but I think of course that's a very like, you know, complicated issue. It may be because of a lot of reasons that they don't speak Mandarin. It may also be because the language is difficult. Yeah, it's definitely not something that you can just, you know, learn in a very short time. Yeah. But for me, I think when I was very, very young, I think at that time, I firstly feel that, I mean, it is part of your identity. So my mother also had a part to play in this because she also enjoys, like, for example, reading those Chinese novels and watching China drama series. Yeah, I think I learned so much just by watching the television series because the kind of Chinese that they use and the tone that they use is actually quite different from what you hear, you know, in like a market, for example. So you start to like listen to it and it's like music, you know, it's like music to your ears. So the way they speak to it, I just was very fascinated by it. Yeah.
So do you make a conscious effort to also learn a good enunciation and all?
Yeah. So the period dramas, I think those people are actually voice trained and they sound so good. And I just feel like, you know, why not just try it? Because actually I watch more like, you know, the 宫廷剧.
Okay.
Yeah. So
you mean growing up with your parents as well? With your mom as well?
With my mom,
Okay.
So my mom also like have interest in that kind of shows. So I think it's just something that I enjoy and I feel like it is part of my identity. Knowing it gives me more confidence. So I feel like there is no need to, you know, firstly, I think you should not reject your own culture. Secondly, I feel like if you know that this is part of your culture, you can try to put an effort to know it a little more. Because that will actually give you more confidence in your own identity. It's the same as how, a lot of black women like Maya Angelou and Oprah, they always cite the poets who are black, and they always cite their own heritage. It's the same concept. Like if you have Chinese blood in you and you feel like you can learn the culture more, actually knowing more of it and knowing a little more about the history kind of gives you a little more confidence. That's what I feel. Yeah. So at times when I feel like scared, I always like think of the phrases I know in Mandarin to kind of encourage myself. Or I just remember that, this civilization is so long, it's been around for 5,000 years.
What is one of it that you use to encourage yourself?
I mean, for me, I actually like to recite certain phrases.
Yeah.
So one of them is, 欲戴皇冠必承其重. So if you want to wear something like a crown, you have to take the responsibility for it. Yeah, so that's something that, I kind of like remind myself of. Yeah, but I think that, I also love the aesthetic aspect of it, the costumes, because I was actually from dance, so we had the opportunity to look at the costumes, and I began to like looking at the designs, and slowly it began to, evolve into liking it as an entire culture. Yeah.
Is your mum bilingual?
My mom is also bilingual. I think she may be a little better in Mandarin than myself because she used to teach in Mandarin.
Oh, so she's a teacher.
Yeah, she was a teacher last time, but now she's like she works in a primary school, but she doesn't teach. She does more of like the operations and admin work. Yeah.
And your grandmother, does she speak dialect?
Yes, she speaks in dialect.
Okay.
So for my
Only in
grandparents, she can speak in Chinese as well.
Oh, okay.
Yeah, so it's a mixture of dialect and Chinese.
What's her dialect?
I am native Teochew, so she speaks in Teochew. So does my mother.
And so you can speak Teochew as well?
So I can speak in Teochew, yeah, because I listen to their conversations, yeah.
Okay, so growing up though, did your mom spoke mostly Mandarin to you at home?
She spoke in both English and Mandarin. So actually, I think when I was very, very young, like, both languages just came at the same time. I didn't like really explicitly differentiate one from the other, yeah. But when I started school, I have to admit that I used English more. Because, you interact with your friends.
It's just the nature of the curriculum as well. Yeah.
Yeah, and I feel like it's important to be able to speak English well because you have other ethnicities as well. A lot of my friends and colleagues are non-Chinese, and I have to collaborate with them for research, and I also enjoy looking at their culture. I may not know as much as them, obviously, but because I'm very curious.
Just having an interest in their culture.
Yeah, I really like I like it when they actually share with me like about Bollywood movies and what they do for their festivals. I just think there's something very beautiful about cultures in general. Yeah. So I think like maybe that's one of the reasons I began to explore my own culture a bit more as a start.
Yeah, I recommend you a Bollywood movie that I saw recently. It's called Gangubai.
Oh, it sounds so familiar.
Yeah, I think it's one of more popular ones. It's on Netflix actually.
Ah, okay.
My girlfriend recommended it to me. It's about this girl who got conned by the boyfriend to become a prostitute in a very poor district in India. Then later she became like a politician, and she became this very powerful and influential. And she looked after the welfare of all her other fellow co-workers and all. And it was a great movie. Yeah. Yeah, so I was very curious about, I just saw Yichun on Friday. I just met Yichun on Friday, 2 days ago. And I was telling her, I was telling you, right, that she was the one who suggested that I take a look at the profile and do a conversation with you. And I was just telling her, oh no, I'm going to use my Kampong Mandarin to speak with Dr. Loh, Then
actually I think like for me, even say when I was in junior college, there was one point when my Mandarin was not up to par at all. So it's a progress, that's up and down.
So you mean your Mandarin became
worse.
Even better after junior college?
Yes, so it went down in junior college because I think I hardly used it at all. Then
because there's no Mandarin in junior college.
Yeah, I don't study the language, my peers and I speak in English primarily, so there is no need to use it at all. So after that, I felt like my language was coming down, and in university, I wanted to write in Mandarin again, so I had to pick it up again. So to me, it's always a up and down process. Yeah, I don't think, there is a point when you say, I'm done with it. I know all of it. I'm very good already. Everything in life is always up and downs. Yeah.
And especially when it comes to a language and a culture,
Yeah.
like any language or any culture, there's just no finishing.
Yeah.
Yeah.
It's just how much you want to push it.
Yeah, the more you learn, maybe the lesser you feel like you know.
Yeah.
Yeah. So you became a student correspondent for Zaobao in uni.
I was actually a student correspondent since secondary school.
Oh, okay.
Yeah, but I continued until university. In junior college, because I was quite busy, I wrote very few articles. Yeah, but I decided that I want to make a concerted effort to write more in uni. Yeah.
How do you become a correspondent with Zaobao?
I think when you are in secondary school, you will have. I mean, most of us will actually have schools helping us order the newspaper.
The 星期五周报.
There's
Oh, the
星期五
Zaobao.
周报, and
星期五
there's
周报.
also the 早报, which is in Wednesday for the youth section. So at that time, my teacher just suggested to me, why don't you try?
Just 投稿 and see
I
what
think
happens.
you might be interested in this, and I just took a look. Oh, it looks interesting.
So you started writing. Okay.
Yeah.
Where do you get inspiration for your writing topics though? Because you are still writing regularly.
Yes, so it's quite different for the Chinese papers because that one I have to actively interview people and look at events. So I cover events like campus events.
Oh, okay.
Yeah, I also interview some of my peers around me who have interesting hobbies or.
So you are like a 校园特派员 something.
Something like that, yeah.
Okay.
But in my English papers, for me, I think I had to be a bit more introspective. So the topics that I talk about will be issues that I feel are relevant to me and maybe other people. Yeah.
I like that your articles are very relatable though.
Right, I think so. And
Yeah,
some of
they are
them
they're very easy
funny.
to read. And
Yeah.
very relatable. And sometimes it's not easy to write. Because when you write, you have to really structure your thoughts and you have to piece everything together.
Right.
And it needs to be succinct. So writing for me is something that it's not easy, and it's something that takes a lot of effort. And for you with your career and juggling a few other commitments, that's something that I find very interesting and admirable.
I think you have to also understand that the writing process for me is actually helpful. So it's not like I have to specifically put down this time and force myself to do it. It's something that I actually would do it even if I don't publish it.
Okay.
It's a way
so you journal?
Yeah, it's almost like journaling. I consolidate my thoughts. But if it's for like a paper, I look at the word limit. I look at what might be interesting to others as well.
Okay.
So I think for me, writing is actually very enjoyable. Yeah, as opposed to something that is like a chore. So I think if it becomes something more enjoyable, I do more of it. Yeah, so it's something that allows me to reflect, and I also enjoy having feedback from others who read my article. Yeah,
so people write to you, feedback?
Some people actually write to me. I actually made friends with some readers.
Yeah, actually that's the most interesting part about putting out content,
Yeah.
I have people who write to me as well.
Yeah.
Because they have watched a certain episode and all. I don't know if you saw, I interviewed Jane. She's the digital nomad and all. She wrote to me about one of the episodes and all. And then I invited her to come on the show and all. Yeah. The Zaobao thing, right? What was I going to ask? Okay, never mind.
Well, I would say that I am actually quite a literary person, whether in English or Mandarin.
Oh yeah, I want to ask you. So how do you journal nowadays? Do you write digitally in the blog? Or do you use something like Notion, or do you write manually in the journal, in the diary?
So for me, I write manually when I have ideas and thoughts. I think that it is about catching the idea and not letting it run away.
Yeah, immediately.
Some people have this preference, but in terms of like making sure the entire article flows, I write digitally because it's how I submit the article.
Are your daily inspiration you would just doodle down?
Sometimes I do doodle down. Yeah, so I think it's not it's not so much about how you do it, but making sure that when you have it, you just jot it down and not lose it. Because I think our society is very fast paced. No one really cares about ideas anymore. Like when you have an idea, you just forget it. Your attention span is not there. But for me, I find it almost like a kind of mindfulness. Like you have this idea, you have to be mindful that you have this idea, and then you write it down so that you don't forget it, and then you can explore it in greater detail later on. Yeah, that's basically why and how I do the things I enjoy, which is mainly writing. In the past, I also did a bit of photography when I was in Lianhe Zaobao. Yeah, but now I think it's more of just writing, and I also enjoy.
So you took part in the video thing as well. Like you follow a director and you learn some Kelvin.
Yes,
or something.
yes.
Yeah.
Well, that was really eye-opening, because I was never, someone who knew much about film.
To go on a set is something
going
different,
on a
right?
set,
Yep.
and you see how they record the voice of the actors.
Yep.
You see how they actually plan the shots, whether it's a wide
storyboarding,
shot, whether it's a close-up. And I didn't know that you have to take so many shots just for one scene. I was just quite amazed by the amount of effort that you have to put in.
Yeah.
Yeah, but I think filmmaking, writing articles, these are just forms of expression and communication.
Yeah. Sometimes when I see a MediaCorp production like somewhere, I would just like, then you see the actor like, going through with the crew and something very interesting.
Yeah.
Yeah.
I think it's good to look at the behind the scenes.
Yeah. We are about 1 hour 20 minutes in. Time now is 3:19. Maybe just a last part. Like, just want to ask you if there are any things that you want to talk about. You'd be interested to discuss, or you want to mention, like talk about,
I perhaps want to talk a little about, because I think we were talking about my background, and I was living with my mother and primarily brought up by her and my grandma. I actually wanted to basically share that I feel like, no matter where you are from, because recently I have a team of friends from that conference that I told you about, whom...
The one in Bangkok recently.
Yeah, the one in Bangkok, whom have interest in reaching out to rural communities, and we are thinking of teaching them something about technology. Yeah, basically the fourth industrial revolution. And
so you mean the team that went from Singapore to Bangkok?
No, so...
Or is it a cross-country nationality
one,
kind of? Okay.
Yeah, so I feel like, sometimes we would think, is it, of any use, to teach technology to a group of children from like a rural community. They may never ever need it or ever see it.
So what do you guys are thinking of teaching them?
I mean, we want to teach them about technology that's related to health as well as global warming. But my point is more of that, we should not actually stop ourselves from doing something just because we think they may never do something with it. If I actually had someone who told me that I can't do what I am doing now because of my background, then I think I would not have done a lot of things. So to me, I think giving them that opportunity to at least know that such things happen and see what they do with it is still giving them like a platform, a chance to learn. Yeah, and for that, I feel like education is very important. Yeah, and I don't think that, just because they come from a certain background, they may never use it is a reason that we don't do it.
You stretch their mind, right?
Yeah, and you help them like imagine what's possible. So I think that's just one thing that I wanted to talk about. Yeah, which is that, no matter what, just try to look at things from a different perspective. Don't think about what limits you, think about what's possible. Yeah, and keep learning. No one can stop learning at all. Even now, even someone who's very old has to keep learning. Yeah, because the times are always changing, and there's always something that you don't know that you can learn from someone else.
Yeah, education is very important.
Yeah.
One of my favorite phrases that I love in Mandarin, right, is 万般皆下品，唯有读书高.
Oh, yes.
Yeah, it's something that struck me. Because, when we were younger, a lot of times our parents, they 谆谆教诲, right, told us about how important it is to have a good education, to have to study well and all. And you don't really understand it until you really come out to society and you start working. And earlier you mentioned about, for guys, we have this opportunity in national service, right? Come across fellow friends, fellow soldiers from a diverse background. And then this phrase comes alive, whereby 万般皆下品，唯有读书高. It's not saying that if you are not educated or you don't have the paper qualification, you will not be able to do anything significant in your life. But it's just such that the structure is such that if you have went through some formal education, you would have some training in learning, and you would have an easier time in society as well.
Yeah, and also informal learning. Like we are thinking of doing like workshops. So I mean, this is not a formal education, but you never know. You may spark off, interest in them. They may want to themselves learn more about it after that.
Okay, so that means the friends that you met in Thailand.
Yes.
So you are thinking of working with these Thai friends that you have made, and you guys want to go
implement it in
do something
Thai
in the Thai village, rural community. Okay, interesting.
Yeah.
What other things on your mind, or what other things are happening in your life? Do you have a boyfriend?
No, I don't have a boyfriend.
Okay, have you ever had a boyfriend?
Well, I mean, formally, I think I don't.
Okay.
Yeah. I mean, I think if it's like a boyfriend, it's like you may consider like being serious, having, kids at some point, getting married, that kind of thing. I don't think I have considered that at this point yet.
I have a personal definition for a formal relationship.
Oh, what's your definition?
My definition is if I have, because I'm still a quite traditional and kind of person.
Right.
So my definition is if they have met my parents, met my family.
Oh, no, then I don't. Yeah.
Then they are like formal.
Okay.
Like we'll go into the count.
Oh,
like
okay,
one ex-girlfriend
cool.
to one ex-girlfriend, two ex-girlfriend.
I see.
Yeah.
Yeah. I mean, no guy has met my mom, I think. Yeah.
Then that means you have never had a boyfriend.
Yeah.
At least in my definition.
At least in your
that means you have never had a boyfriend.
Yeah. But I think that for me, it's also about like which phase of life you're in. Yeah. I mean, I also have friends who get married very early. I think there's no right and wrong answer.
Do you have peers who have already have children, become mothers?
They were actually mothers very young, like early 20s. I mean, I've heard of that as well. It's not uncommon, and I don't think there's a right and wrong answer. It's just what is best for you, and also what fate brings you. I think
my brother became a father at age 28.
Ah, okay.
Yeah, so
congratulations.
Yeah, so my nephew is turning 2.
All right.
Yeah, and my brother is born in 1992.
Okay.
Yeah, 1992. You are born in 1996, I suppose. 96, 97.
No. I'm Gen Y.
No. Sorry, you are born in 1993 and 94.
Yes,
Yeah. Sorry, I got my dates wrong.
It's okay.
Yeah, 1993, 94.
96, I think you're probably like 24 or 5.
Yeah. Okay, so this whole coming to phases in the life, right? Yeah. And just moving on with life, do you take a more deliberate approach towards planning your life stages, or do you more go with the flow and depends on what fate throws you?
I think for something like the one you mentioned, like relationships and all that, I think a lot of it is out of your control. Yeah. So
no, I don't. I disagree.
So?
No.
Really?
I think intention is very important. Because if you, of course sometimes it can. I don't know if you watch K-dramas.
Yeah.
Crash landing on you, right?
Yes,
sometimes someone can drop from the sky literally and be stuck in a tree and something happens. But on the other hand, I think for most people, and with everything in life, not just a relationship or just like marriage or having a going to a relationship, I think intention is like often something that would kickstart the whole process, and it's also something that would impede the process as well. So if you don't have an intention, right, and you just say that okay lah, when it happens, then it might not happen.
Yeah.
Because you might be closing off your signals to potential opportunities as well.
Yeah. I mean, I admit that I think because it was not really a priority, for a large part of my life. Actually, I wrote an article about my experience as well on this, which
what's the gist of it?
It's about my experience as a single woman and whether it's considered being a leftover woman, which is a term.
Ayo, how old are you, like?
Well, I mean, I think it's interesting to explore it still.
Other women's blood will be boiling reading an article. Someone in the mid-20s writing about this.
Thanks for the reminder.
No, but it's something that, because I'm 34.
Oh, okay.
And it's something that time passes very fast after a certain age. I don't know if you feel like time passes very fast after you enter the workforce and all. But
definitely, for sure.
Yeah, but when you are I could imagine when you are preoccupied with a lot of other priorities, right? Like sometimes just finding another partner is not a priority.
Yeah.
Yeah.
I think for a large part, it's also about the willingness. Because I wasn't too willing to spend too much time and effort when I was a student. I mean, I feel like when I was a student, I wanted to pursue other things first. So I think that was the mindset. Yeah. I mean, I think, yeah, I mean, it's good to be more intentional about things, yeah. But I have friends who are also very intentional, but just didn't manage to find the right person.
They didn't manage to find the right person.
Yeah.
But just by the fact that they are more intentional, that means they are more likely than you to find
Yes, you're right.
the other person.
Yeah, I think it's something that I probably have to think about, maybe work on soon.
Okay.
Yeah.
What's your do you have an ideal kind of guy that you like?
I haven't actually thought so much, and I think as I become, as I actually look at more people, actually I feel like this so-called criteria become much more blurred. You know, maybe when you are much younger, you have this idea of like Prince Charming, and like, oh wow, you want like someone who can maybe play the violin or someone who is very this, very that. But as I become much older, I honestly feel like it is not about this specific attributes, but the entire person as a whole. Yeah.
So the chemistry.
I think it's the chemistry and also whether it's a good fit. Yeah.
So what are some values that for you in your life that you feel is the most important, like baseline, non-negotiable, that you feel your partner can have, ideally share some of these values as well?
Right. I feel like I prefer someone who actually like strives for excellence. Yeah, because I feel like, you know, no matter what you do, it can be completely something that I don't understand. Yeah, but you know, the fact that that person is putting so much effort in something, yeah, I find that very attractive. Yeah.
What's your Chinese equivalent phrase to describe this attribute?
Chinese equivalent.
Is it 上进心 or is it just?
I think 上进心 is fine.
上进心 is fine?
Yeah.
Because I think it feels a bit different though.
Yeah.
Like for example, if I want to be the best, right? Like I want to
精益求精.
精益求精. So if I sell chicken rice, I want to make sure I sell the best chicken rice. Yeah. Then if
It's
I'm
quite a funny way of putting it.
if I'm a coder, I want to make sure that I'm the best coder.
Yeah,
you
something
know.
like that. Yeah.
If I'm, but at the same time though, they might not be. Well, I suppose it's an aspect of 上进心
It
as
may
well.
not really be related to work. It can be anything else.
In life as well.
In life, as long as you have a pursuit that you really focus on, I find
There are a lot of episodes in 奇葩说 exploring this kind of this kind of topics, right? Like whether 上进心 is good to have it or not good to have it. 没有有错吗?
Yeah.
And also if your partner is 一条咸鱼, you know, 要炒一炒啊, you know.
That's so funny, some of them.
Yeah.
Yeah. I enjoy watching it.
Yeah, so it's interesting. I mean, just wanted to keep up a bit.
That's good.
Yeah.
I think curiosity is always good.
People who want to go after you will be watching this.
Okay.
They will Google
reminder.
you and they will, So they know that they must have that kind of mentality to excel.
Yeah, something like that.
Okay. I also recognize that after being in relationships, that often the coming together of a couple, right, is not just about two person as well.
Right.
It's sometimes about two families as well.
Yeah.
Yeah, because you are not just you, right? You also come with like your mother who you would love to take care in the old age and all. And he would also come with his parents, his siblings, you know, the in-law problems and all. Yeah, so these are all issues that adulting, you know, there's this that people always talk about adulting, right?
Yes, yeah.
Yeah, these are all adulting issues that people learn along the way, you know.
Yep.
What do you struggle with adulting the most in terms of adulting?
I think that adulting is, I think the main thing that I feel is very different. Number one is that you start to have an income. So you start to have financial independence. Actually, I find it very liberating because
Adult money.
because you finally like don't have to depend on your parents. You have a say in what you want to do. Like for example, if you want to, have a trip or you want to take up some lessons, it may be anything like yoga or whatever. You don't have to consider so much. If you have the money, at least you can do that. I find that very liberating, and it gives a person a very huge sense of independence. Yeah, and the the problem though is that, you know, as you become like slowly a young adult, you also have other issues, right? Like you have to consider about, you know, whether or not people are, you know, competing with you, whether you're competing with other people. I think it's quite natural. Like, you know, you may look at someone's career progression, they may look at yours, and there's a lot of comparisons. I mean, it's very common
inevitable,
in Singapore. It's inevitable. Yeah. Or someone may say, you know, this person's already getting married, why aren't you married yet? I mean, all these are stressors that, you know, would be there, I think. As you start to become an adult, people expect you to move into a certain phase. Yeah, so those are things that are, I think, problems, but I still feel like it's quite interesting and entertaining if you look at it in the right perspective. Yeah.
So what you're saying is your stress is coming from people's opinions of you and who you should be?
I think some people may feel stressed by it, but for me, because I take it very lightly, I think, for me, I think that people they should be allowed to think what they want and say what they want, but I don't let it affect me so much. I think it's quite funny that they make certain statements. I genuinely think it's funny, so it doesn't really affect me much. So I think it makes my life more interesting that they say these things actually.
So for example, something someone has said?
Yeah, maybe they may say like maybe if they compare me with my friend, like my friend is already married or expecting or even having a baby already.
Like, why don't you even have a boyfriend or relationship yet?
But I kind of think that it's quite funny that they are worried about this. Yeah, I don't think that it should actually be something that is defined just by age. I mean, of course, there's still age to consider.
Yeah, I mean, a woman has a bio clock as well.
Yeah, there's a bio clock. Yeah, but I feel like it is about knowing what is your own pace. Yeah, and I'm also less affected by what people think of me. Yeah, I mean, some people may think who don't know me sometimes. Yeah, they may think of me in a certain way just by, for example, reading my articles.
Of course. Yeah. We all form impressions of.
Yeah, they may consider me. They may consider me to like be part of a group that they imagined, and they may have not known like what I have been through or what kind of person I am.
Of course.
So in the past, maybe I would have taken it a bit more heavily, like I would feel sad. Yeah, but now I feel like you can't feel that way all the time. I mean, everyone has their viewpoints. Yeah, you can't please everyone. Yeah, it's what I learned from some influencers who managed to basically change, you know, comments on their YouTube videos into something funny. Yeah, so like maybe they said like called that person a pest, PEST.
Yeah.
They misinterpret it so that it's best, BEST.
Okay.
So that's quite funny, right? I mean, that person is like taking it in like a funny way, injecting some humor, making everyone happy, and she herself was not affected by it. Yeah, so I feel like, you know, wow, that's a great skill. I should do more of that. Yeah.
So not be too affected by external factors.
Yeah.
Okay.
I think you have to take constructive feedback, but a lot of people who actually just shoot, you know, certain comments. Yeah, I mean, they are anonymous people. They can say whatever they want. Yeah, but you yourself, your reaction is what you can control.
And honestly, they posted and they forgot about it immediately.
Yeah.
They are off to the next post, the next content, you know.
Totally.
And all. Yeah, and you are there festering with that negative feeling. Some people might look at you and feel like, wow, you are so all-rounder and you are so, you know, holistic and like you are doing so many things. Do you have a inferior complexity that you struggle with now or growing up?
I first think that it's probably the impression they form, but I think that's very far from the truth because I am only interested and good at what I usually do, but I am bad at a lot of things. Yeah. Like cooking.
All of us.
So bad at it. Okay. I really can't do it. There are so many things that I am bad at, but you know, they focus on the things that I do.
So you try to cook, but you realize that you can't really do it.
It's not something that I feel I have a natural inclination to.
Okay.
Yeah, I mean I like to eat good food, but I just can't really cook very well. So that's one thing that they don't know. Yeah, they don't know that I'm bad at it. Yeah. So don't tell them. Yeah, but I mean what I'm trying to say is that you know, as long as you are good in whatever you are doing, it not necessarily be what I do. Like, you don't have to write well if you don't think that that's your cup of tea.
Not everybody is in languagely, like linguistically inclined.
Yeah, it's not for everyone. Yeah. So if you are good at cooking, like, I actually respect that a lot. Like, I love to watch Gordon Ramsay and his
just cook something or just dissect a chicken or something.
Yeah. So I think like this term, like all-rounder and all that, is very
narrow as well, right?
It's narrow, and the definition is not clear. Yeah.
Oh, okay. Then
what are you actually all-rounded? I'm so bad at many other things that I don't tell everyone. Yeah. So you don't tell them as well.
Oh, yeah. Many guys who are interested in you will be watching this, and they will be like,
okay. That's important for them to know.
Yeah, they'll be finding out things about you.
Yeah.
Yeah, and I also think that, you know, for people like us, you know, we have some content out there about ourselves.
Yes, yeah.
And people tend to form very quick judgment from many things.
Yes.
They infer, they make certain conclusions, or at least they have an assumption until they prove it. Like, for example, to be very honest with you, I was talking to my girlfriend about my upcoming interview with you today.
Okay.
And I was saying that, wow, you know, her 真的是字正腔圆, you know, the way she 咬字, wow. And one of the things we discussed was whether you are like a Singaporean, like whether your parents are Singaporean.
Yeah, I get that a lot. Yeah.
Because we have this impression that your language, and it's something that from young you are cultivated and nurtured, right? So maybe your parents are from China, and that's why you speak with you're used to speaking that kind of accent. Yeah, these are all the little conclusions that people might form just for the time being, and they just like live with it until they get to know you as a person. And when you put yourself out there, nobody can know you as a person. And that's why I think, like, for this podcast, right?
Yeah.
I wanted the format to be a bit more informal, or rather a lot more informal. And it's really more of a conversation.
Yeah. I think, well, just one quick point is that actually I like, I mean, not like, but I try to practice different accents sometimes.
Oh, you
it's
do?
just my little, it's just something interesting about me that
in
I
both
enjoy
languages,
doing.
English and
both.
Okay.
Yeah, so if the time calls for it, I speak in a very Singaporean accent. If the time doesn't call for it, I change to something else. Yeah, so it's just an interest of mine. Yeah, that I'm sure a lot of people may not know because they think that that's my natural accent. But for me, because I practice, so it's just something that I like to do. Yeah, but I get that a lot. You know, whether your parents are actually non-Singaporeans. And I mean, they also make other very quick judgments about me. Yeah, few people know about my background. Yeah, because they see the you now, they don't know the you in the past. So I think maybe that's why a lot of my close friends are from my primary school. I keep in touch with them, and I feel like they know me very well. Like they have seen me grow up, and they know what kind of person I am. So for that reason, you know, we are still in touch, and we can really talk, like, you know, have a heart-to-heart talk.
And also for like yours, right? You know, when you have feature videos on YouTube.
Yes, yeah.
Like 3 minutes, 4 minutes and all. It gives people a very narrow snapshot of who you are.
Yes.
In that aspect. So they from there, you know, they immediately, okay, you know, doctor speaks well, good in language, and immediately they form all this. And because it's just 3-4 minutes, right? There's so many things behind us, like our entire life, our whole life stories and our experiences.
Yeah.
And that people do not get a chance to learn about.
Yeah.
And it's so curated.
Yeah, correct.
So directed, you know.
Yeah, and you must also know that there's a time limit. I mean, for your podcast, it's very long, but for a lot of other kinds of videos or articles, there are always, you know, limits, word limit, time limit, all that. You can't really convey very big ideas in such a short time sometimes. Yeah, and I wish they knew that a bit more. Yeah, but it's okay. Yeah. I think that it's also part of human nature to be misunderstood. So it's something that I've slowly begun to learn about.
Okay. So what's one more thing that people should know about you that you haven't mentioned today?
That I haven't mentioned today that they should know.
Or it's interesting for them to know.
Is that I actually really have a lot of hope to learn more about, for example, TikTok, which I have not actually mastered. I am very interested in media, but I am not good at certain social media, and I actually really respect people who do this well, like including yourself. Like you have a very good YouTube channel. There are so many other young people who use TikTok to influence others.
What do you think of mastering in the TikTok aspect?
I think that the problem with me is that people follow the things I write on a channel that is relatively formal, so they don't actually see
And there's
other
a style
aspects of
to
me.
it.
Yeah, there's a style to it. Yeah, but they may not necessarily follow me as a person. So I mean, number one is that they don't get the full picture. Number two is that they see very curated pieces of you, which is better than nothing. Yeah, but I wish that I could put out more like lifestyle content that people will enjoy. Yeah, and they may be interested in things that are not just the big issues that I often write, because a lot of the things I write are commentaries related to myself, but also very much current affairs. Yeah, but there's just other parts of me that are just very quirky, funny, that people don't know.
Yeah.
That's the issue. Yeah.
I don't know if you remember in one of the episodes in 奇葩说, Cai Kang Yong was talking about Xiao S and their program 康熙来了. And he was saying that one of the reasons why 康熙来了 is so popular and relatable, right, is that no matter who comes on the show, be it Stephen Hawking will come, like Xiao S is not going to ask about the black hole or like physics or equations.
Right.
Xiao S is still going to ask him like, what color is your underwear today?
Yeah, it's so funny.
And
and it makes it more interesting because like all the black holes, I believe you can just Google it or something like that.
Yeah. And that's something I hope to do on the show as well, on my show as well, to just showcase the person as a person. I think that's very important as well. And because I have the luxury of time, right? It's a long format. Then afterwards I timestamps.
Yes.
I timestamp the video on YouTube. People can still go in and filter out what they want to, what they're interested to learn about.
Right. Actually, there's one more thing that I suddenly remembered that I should also say.
Please.
That you mentioned I should let people know, which is that I actually think that it's quite important because I'm female and my household are full of females because my mom, my grandma, they're all females. I feel like women should not, feel like they have to do something that's very feminine in order to fit into what society expects of them. So, when I was a child, I'm also the only child, so I had to do a lot of things that are relatively guyish, I suppose, like fix my own computers, change light bulbs and stuff like that. That can feel very masculine to some people. Or even in the past, if you tell people you want to do things that are STEM related, engineering, they will feel as a woman, are you even cut out for this? Is it suitable? But I feel these are actually a lot of labels and people's expectations of what a woman should be. It is not necessarily what you have to be. You can be a woman and a very good engineer, or you can do things that were thought to be more suitable for men. Yeah, but I think in this day and age, we should not be defined by what people expect of you, expect of us. As a woman now, I feel that it actually empowers you more. Yeah,
do you feel the pressure to conform to gender stereotypes?
I think in a lot of Asian communities, there is still some idea that, child rearing sometimes is still predominantly by the mom. Yeah. And I think people also there are definitely some gender disparities in terms of what people expect of you. Yeah. But in terms of what you can achieve, I feel that the possibilities should not be so limiting. Yeah.
I look around me and I see that the men are taking up much bigger roles nowadays. At least amongst my peers.
Yeah, actually in medicine, I think a lot of people don't know, but if you go and search it up, you can find it in newspapers, which was that actually they did not take in as many women as medical undergraduates after the interview. Yeah. It was actually something that women had to basically work towards and campaign for.
So it was in Singapore?
In Singapore.
It was deliberate?
It was deliberate, but the understanding...
So they had a ratio that they had in mind?
I believe there was some belief that if you admit too many women, a lot of them may not practice medicine, and you would waste the time training them to be doctors. And thereafter, you don't have enough doctors in Singapore.
So they might drop off, they start a family.
Yes.
Blah, blah, blah. Okay.
Yeah. So that is one reason, the female doctors, I believe some of them actually wanted to make it a more equitable admission process.
And this is how many years ago?
Yeah. If I am not wrong, I think it was changed in 2004.
Okay.
Yeah, I read articles about it, so that was how I knew. I mean, of course, I was not old enough to know the full picture back then, but it was alluded to. Yeah, so I think it was probably like Straits Times or Today or something like that I read. Yeah, basically like a mainstream paper. Yeah.
Which other aspects do you feel like there's this pressure of gender conforming to gender stereotypes? And
well, I think that the capability of women shouldn't be questioned just by basis of their gender. Some people still feel like in order to be, say, in a very important position, like say if you want to be like a CEO, or if you want to do something that's very technical, it is not so suitable for women. But I feel like that's slowly changing. I mean, people start to accept it a bit more, and they see more examples of good women leaders. Yeah. So I think it's kind of important to emphasize this, because I feel like society, you never know when they regress. Sometimes they are actually very progressive.
So we have to keep pedaling forward.
We have to remind
or else
ourselves.
We would just
we have to remind ourselves why certain things got to where they are today. I mean, for Singapore, I think in medicine, for example, now it's very equitable. Yeah, but you never know. One day, some people may just say, no, we should go back to then. It may happen.
It might happen.
Yeah, I think I have begun to believe that it's not a natural process. People have to actively understand that they have to push for certain things. Yeah, and basically safeguard certain things that are already there for fear that it may regress. Yeah.
Yeah, I agree with you. These are actually concepts that I am very concerned with as well.
Yeah.
And that's why as a platform, I try and bring up these issues. You spoke about, you watch Aries episode, right?
Yeah, I did.
And of course, this month, June, coming to July, still June, is Pride Month. So I just had this conversation with my girlfriend this morning about this, because we were watching some interviews that people did at the Pink Dot.
Yeah.
And this concept of toxic masculinity, right?
Yeah.
And I was just of the opinion, it might not be a popular opinion, that why is there toxic masculinity? There's a reason why there's toxic masculinity. Because if you look at the evolution of humans, right, when we were in the hunters-gatherers, or even when we are taking peace for granted today. We expect that there's peace in Singapore, right? And there's no war and all. But men do national service. And men are still expected to go and fight the war first if a war breaks out in most of the countries. Conscription is still men, right? So if there is, now we have termed this as toxic masculinity, but what if men are all encouraged to express their emotions very freely, and we should be allowed to cry when we want to, and we shouldn't be telling I shouldn't be telling my nephew, hey, look, stop crying, you're a boy, wipe your tears and, get your act together, right? So as a society, right, if we don't have this kind of, for the last centuries of development, what happens when a boy becomes a man, picks up a rifle, go to war, and your buddy's head is busted by a bullet, or explosion, that, and you just start crying there, and you get frozen, right? And you can't move forward with the objective. And therefore, if you go back to the development of humans, if during the time of hunters-gatherers, it's the men who are out there hunting, right? Because they are stronger, they are faster and all. So if you are scared by the appearance of a lion in the jungle one day and you just stand there crying, you're going to die, It's a matter of life and death. And therefore, this has evolved into this whole culture of a boy, you are a boy, right? So you should man up, and all.
Yeah.
And so my point is that, of course, it's a healthy conversation to have, and it's a good topic to explore, because sometimes when a concept is taken beyond a certain healthy kind of, then it becomes toxic, right? But at the same time, I think a lot of people are talking about it without taking into consideration other factors.
Yes.
Factors such as the peace that we enjoy. If today we are in Ukraine, right?
Yeah.
Are you going to tell your husband or your brother or your nephew or any man that, come express your emotions, cry when you need to. Then tomorrow go and fight the war, like you're just going to be confused, right? Like when you're fighting a war when life and death is, like emotions just can't get too much in the way. So I think there's a lot of aspects to it that can be explored. But a lot of times, sometimes we take one concept and we simplify it and we just look at one aspect of it and we just. So that's just something that I discussed with over breakfast with my.
Okay.
With
I
my
think
girlfriend.
I mean, just a very quick input. I think that the idea of toxic masculinity is not to say that you have to show weakness as and when you want, know, and it is not about not seeing courage or, for example, other virtues, like being able to take responsibility as something important. Like all these are still important. So you should still actually encourage having these values. I mean, these values are so common, in like say our school mottos and stuff like that, right? For me, my primary school motto was courage and sincerity. So I mean courage, to take on challenges. But I think that it is more of like looking at not like something so situation specific. When the time comes, like when there is no reason for you to still expect the man to not seek help. Then that is the problem. If there are 1,001 reasons that is not the number one priority in your mind right now, then I mean it should not be something that is so high on your agenda. Only when in times of peace and quiet, like say the aftermath of war. Actually, a lot of war veterans have PTSD. So that is the time then to
seek help.
To see whether or not we should still ask men not to show weakness when there is absolutely no reason why they should do so, right? So I think it's also very about the context in which you put it in.
If you have children in future, and when you have children, let's say a boy and a girl, right? Do you think that you would raise them up with different standards for certain things, or different ways of teaching them?
I am definitely not an expert on parenting.
Do you imagine or visualize yourself having different standards for boys and girls?
I think I would still want both of them to do the best in what they are good at. So it need not necessarily be something like the boy has to do something very guyish. If he wants to do like fashion design, I'm completely...
that's fine. I mean, maybe let me be more specific. Like, let's say discipline. Like for me, I see. Let's say for me, right, I envision myself, right, to be stricter with my boys.
I see.
Like girls, daddy girl, I'll be like more lenient with.
I've heard of that. But I mean, personally, I haven't actually known very much about how you discipline a child.
Okay.
To be very honest.
So you haven't really thought about it?
I haven't thought about it,
Okay.
And for me, I think as a child, I was quite, I didn't need too much discipline. So that was lucky. Hopefully they all turn out like that.
Hopefully. Okay, Dr. Loh, I think we have had a good conversation. If you have any last words?
I think that's about all.
Okay. If not, I think we can, I hope I can explore with you to do an episode in Mandarin.
Okay, that sounds great.
For the new show.
I would be happy to.
It's going to be called 播客人.
Okay.
Instead of Mr. Talk. So 播客 is the name for like podcast. So it's just 播客人. And and if you're interested, it's an open invitation to you. I'm also trying to explore a format. Like for me now, because it's just like my own gig, right? So I'm open to exploring like all kinds of format on the shows. I'm also trying to explore a format whereby there can be guest hosts on the show. And I can take care of the production aspect of it, like the editing and the, just the technicality of putting together an episode. Then maybe, if you're a host, a guest host on one of the episodes, and there's someone that you'll be interested to speak with, and they have agreed to an interview, and it can be an episode on the show.
Okay.
And you can be the host.
Wow.
And you can have an interviewee that you produce the questions, and you come up with you book the guests, and I'll be here to produce the episode, and you will be distributed on that current platform.
Interesting.
Yeah, we will explore this. If not, I thank you so much for your time. It's
you.
been a long weekend for you. I'm sure all weekends are like hectic.
Yeah.
You should go back and take a rest. And
Yes.
I look forward to people finding value from the conversation that we had. And we will have another one in Mandarin.
All right.
Okay, thank you so much.
Thank
Bye-bye.
you.